Hey everyone, so let's talk about some cardiovascular drugs today, namely our ACE inhibitors and our angiotensin II receptor blockers. Now this might sound intimidating, but I guarantee you've heard of many, if not all of these drugs before. So cardiovascular drugs, let's first define the cardiovascular system and what it does. So they work either directly or indirectly to treat and manage diseases and conditions of the cardiovascular system. That's conditions of the heart and the veins and arteries, as well as the blood. The blood vessels, veins, arteries, I should also say capillaries as well. Those capillaries are those tiny little blood vessels that work from your extremities and to transport blood into your skin and varying other places. They're sort of the midpoint between the arteries and the veins. Arteries, of course, flowing away from the heart with oxygenated blood, veins going to the heart with the deoxygenated blood so it can be pumped back into the system and restart again, circulating throughout the body. Among the most common cardiovascular drugs, or CV drugs, are ACE inhibitors and angiotensin II receptor blockers, or ARBs. Now, both work to produce a therapeutic effect through mechanisms in the renin-angiotensin-aldosterone system, or the RAS system, and both are often used to treat high blood pressure or hypertension. You don't have to worry about what the RAS system is. It's just a way of the body to maintain blood pressure and what we call homeostasis, the normal functioning of the body and all of its organ systems, one of which being the cardiovascular system. Now, how do we define what blood pressure is good and when people might actually need therapy? Well, these are our current blood pressure categories. You don't need to memorize this, but I think it's good general knowledge to know anyway. So your systolic blood pressure, the upper number, and the diastolic blood pressure is the lower number. You normally want to aim for 120 over 80. So anything less than 120 over 80 is normal. An elevated blood pressure would be considered to be 120 to 129 over 80. It has to be less than 80. If it's any more than 80, the diastolic number that is, then you would be considered as having high blood pressure. That's 130 to 139 systolic or upper number, or 180 to 189 diastolic. Now you get into hypertension, which is high blood pressure, and that's clinical high blood pressure, when you get to 140 or higher systolic or 90 or higher diastolic, so either one. And then there's a hypertensive crisis, which is when you consult your doctor immediately. That is higher than 180 or higher than 120. That's when you either call 911 or you go to the ER to find out what's going on. So what are ACE inhibitors? They are angiotensin converting enzyme inhibitors. So angiotensin is a hormone within the body, which is present in the blood. And what angiotensin does is it promotes biological processes that raise blood pressure. So it increases blood pressure. Angiotensin contributes to hypertension. ACE inhibitors interfere with the biological processes that make angiotensin. So when there's not as much angiotensin in the blood vessels relax, and that lowers the blood pressure. So think of it like a hose almost. When the blood pressure is squeezed and constricted, that would increase the pressure, right? Because you're trying to force the water, trying to force the blood through that smaller space. Whereas if you increase the diameter, the circumference, then you're better able to treat hypertension, and it's allowed to flow more easily and slowly through those passageways in the cardiovascular system. Now we have ACE inhibitors with a special warning for pregnancy, and they have to be discontinued in favor of other less dangerous drugs in pregnant women. So always ask if a woman is pregnant or planning to become pregnant before putting her on an ACE inhibitor. And they have two notable side effects that sort of separate them from other drug classes. The way that ACE inhibitors work is they, through certain biological processes, they can actually contribute to a person having a dry cough. So they may notice after being prescribed an ACE inhibitor that they start coughing, but it's not like they're sick or anything. They're not coughing up any mucus or anything. It's just a dry cough. That could just be because of the ACE inhibitor, and you may want to transfer them to a different agent if it's really bothering them. The other one to really look out for is hyperkalemia, or high potassium. That's a potentially dangerous side effect. Can have neurological issues if the potassium level goes too high, although I would say that's fairly rare when using ACE inhibitors. Nevertheless, you still monitor for it. And this is just an illustration of how ACE inhibitors work. You see a constricted blood vessel, which would force more blood through it. It would be a little bit of a tighter space and therefore higher blood pressure. By relaxing that smooth muscle that is around the constricted blood vessel, you increase the space in the lumen, that empty space, for all of the blood to flow through. And that's what lowers the blood pressure. Now, ACE inhibitors are easy to remember because they all end in the suffix pril. So P-R-I-L, they are your pril drugs. Enalapril, lisinopril, ramipril, otherwise known as Vasotec, Privinil or Zestril, and Altase. Those are all ACE inhibitors that are in your top 200 drugs. And there's also some combination medications to decrease pill burden as well. So a lot of times when patients, especially if they have like heart disease and a few other contributing factors, maybe they have diabetes as well. Maybe they're also taking something for a psychiatric condition. They might have some pain medications as well. You could see people taking upwards of 10, 15, 20. I've seen people on 30 different pills. So if they say, I'm not going to take one more pill, you might be able to recommend a combination medication, such as lisinopril and hydrochlorothiazide. So you can use that to treat various cardiovascular diseases, 2 birds with 1 stone, that kind of method. Side effects, again, with ACE inhibitors, remember it's a dry cough. Dizziness and fatigue are also possible. I should say with any blood pressure lowering drug, you do have the risk of dizziness, especially upon standing, or fainting upon standing, feeling tired, because if you artificially lower the blood pressure and you suddenly stand up, then all the blood drains from your head into your lower body too quickly. That can cause people to feel really faint, otherwise known as orthostatic hypotension. So I always make sure to counsel on my patients who are first starting on their blood pressure medications. Make sure that you don't stand up too quickly until you at least know how this blood pressure medication might affect you. Or you may want to, if you're laying down, sit up first, give it a minute, then stand up. Just take it easy, at least when you're first starting on the medication, at least until you get used to it. Next, we have our angiotensin II receptor blockers, or ARBs. Again, these drugs work by limiting the effect of angiotensin on the cardiovascular system, and thereby they lower high blood pressure. They're used to treat hypertension. They lower high blood pressure. They relax the veins and arteries. Again, very, very similar to the ACE inhibitors, so that the heart can more easily pump blood through those. Now, very similar side effects to ACE drugs, although they don't have any dry cough as a side effect. The one kind of nasty side effect that they do have that ACE drugs do not have is angioedema, which is that gnarly looking picture with this poor guy. It's a swelling of the lips and face. It doesn't happen in very many patients, but it can be quite severe when it does happen. So oftentimes, if you start seeing swelling of the lips or face, they immediately advise the patient to discontinue it, and they move them to either an ACE or some other blood pressure controlling medication. And of course, hyperkalemia, just as with ACE drugs, is also a concern. Now, examples of ARBs, again, these are really, really easy to remember. Why? Because they all end the same way. So we have our sartan drugs, not Satan. I've had so many patients say, like, I need my Candacetin, my low Satan. We're getting to that spooky time of the year, but it's not quite there yet, right? So that's going to be great, by the way, when this video gets viewed in the spring by the next class. So shout out to cohort 2. Anyway, we have candesartan, otherwise known as Atacand. We have losartan, Cozar, olmesartan, Benicar, and valsartan, which is Diovan. So, and many ARB drugs are also combined with hydrochlorothiazide. You'll recognize that drug from earlier rather. And hydrochlorothiazide is often abbreviated to HCTZ because it's a very long and difficult to read and pronounce word. But hydrochlorothiazide is a diuretic, which also treats hypertension. You might be familiar with diuretics and how they're called water pills. They're often combined with the drugs that you see above here. So there's a candesartan HCTZ combo, which is Atacand HCT. There's losartan HCTZ, which is Hyzar, and valsartan hydrochlorothiazide, which is Diovan HCT. And that just about sums up your ACEs and ARBs. Hope you learned something today. Thank you very much.